Hello, Curry County residents. My name is Ginny Williams, and I am the CEO for Curry Health Network. If you're watching this video, you're probably interested in learning what's going on at Curry Health Network. But before I get to specifics about the network, I think it's important to start with the larger picture. Hospitals in Oregon have been experiencing a capacity crisis since the Delta variant of COVID-19 surge, and the crisis has recently intensified due to the convergence of influenza A, COVID-19, and RSV in the state and nationwide. Governor Kate Brown declared a state of emergency in Oregon on November 14th because of a rapid rise in hospitalization of children with RSV in Oregon, and the capacity crisis has been further complicated with staffing shortages in all hospitals throughout Oregon. Curry Health Network is a critical access hospital, and unfortunately we do not have the capacity to treat critical medical conditions such as heart attacks and strokes, things that require major surgery, or other disease states that just require an ICU level of care or intensive care. Under normal circumstances, patients with those critical conditions that require a higher level of care are stabilized and transferred to the nearest facility equipped to care for them. But because the hospitals in Oregon are operating above capacity, Curry Health Network and other hospitals are having a difficult time finding a facility to accept the patient. Last week, 3 hospital systems in Oregon implemented crisis standards of care in response to the surge in RSV and other viruses, allowing them to deviate from nursing staffing plans. Those 3 systems include Legacy Emmanuel, OHSU, and Providence. Crisis standards of care, as defined by the Oregon Health Authority, occur when critical care resources are severely limited, the number of patients presenting for critical care exceeds capacity, and there is no option to transfer the other to another critical care facility. Curry Health Network unfortunately met that standard on Wednesday, November 30th, because of our inability to transfer patients from our emergency departments for many hours and sometimes days. According to the Oregon Health Authority, a hospital must meet specific criteria and follow regulatory statutes in order to declare that it's operating under these crisis standards. Curry Health Network does meet the criteria according to the regulations, and we've taken the following actions. We opened our incident command on November 30th and declared an emergency. We notified Oregon Health Authority that we needed to implement our crisis standard of care. We posted a notice on our website. We posted signs prominently throughout our emergency departments and in our lobbies. And we are making our crisis standards of care policy available to the public. You can download that from our website, or if you're visiting our facility, you can request it, and any staff member will be willing to provide it to you. Holding patients in the ER for extended periods of time and being at or near inpatient capacity, combined with limited staffing, has also resulted in Curry Health Network having to deviate from its nurse staffing plan. We are working with our nursing staffing committee to finalize the safest staffing plan possible for patients and staff. I must say the situation at both of our emergency rooms changes literally by the minute. At times we have had to hold patients for as many as more than 50 hours, and we've seen as many as 20 patients register to be seen within a short 1.5 hour period of time. We've responded by making contingency plans to provide additional physician and mid-level assistance in the ER if we continue to experience the surge. And we've received a temporary license from the Oregon Health Authority to expand the ER space at our facility in Brookings if needed. We are working to implement safe solutions to meet the community's demand, but as I said, the situation is very fluid. I am proud that our team is responding efficiently, effectively, with agility, creativity, and teamwork. But most of all, I'm just so impressed at how caring and compassionate they are to all of our patients. Curry Health Network appreciates your patience when the time waiting to be seen in the ER may be longer than usual, and you should know that we triage, prioritize, and treat those patients with more severe or serious conditions before seeing those with minor conditions. For those awaiting transfer, we provide the very best care to keep them in a stable condition until that can occur. It is important to know that even during these challenging times, If you are in the need of emergency medical care, you should not delay and continue to seek care at an emergency room. Curry Health Network is grateful for the community's concern and patience, while we, as always, remain committed to compassionately provide the best treatment and care possible. Thank you very much and have a good evening.